real annoying.
Hey there. My name is Megan Clanahan. I am the co-owner of Houston Moms. You have seen us here every month this year in 2021 with our professionals from UTMB Health. Today, I am privileged to bring you Dr. Annie Goodwin. She is a pediatric GI, and she is going to explain all of what that means. And we're going to talk about pediatric gastroenterology. Think I got it, as it relates to our children. So Dr. Goodwin, thank you so much for joining us today.
Thank you so much for having me, Megan. So excited to be able to come and speak with you all.
Absolutely. So tell us a little bit about where you practice, kind of your background, a little bit about yourself.
Sure. So I'm originally from the Northeast, did my undergraduate studies up there at Brown University, and then did medical school at the University of Connecticut. And then met my husband, and he convinced me that we should move down south. So did my general pediatrics training at the University of South Florida, and then came out here to Houston to do my pediatric GI fellowship at Baylor College of Medicine, Texas Children's. And Houston is sort of where my family has settled down. I live out there with my husband and our 2-year-old baby girl who teaches me every day how to be a more patient mom. And we have a 5-year-old beagle dog who is our first child. And so currently, I just joined the UTMB faculty in September of 2020. And my clinic is currently located here in Clear Lake, but we cover both the Galveston Hospital as well for inpatient consults and the Clear Lake Hospital.
Perfect. And I love that you have a little 2.5-year-old. I think not only do they teach us how to be a better patient mom, but like just a better patient person in general, especially with the 2.5-year-old who is starting to, I'm going to start praying for you now for the 3. The 3,
you're at age 1.5 and we're still sort of going.
It gets special. 5 is amazing. I can tell you that. Mine are 10 now, and people probably know this by now, but I have twin 10-year-olds. And so you start the next part of your life when they turn 10. So just hang on, 7 more years, you got it. So thank you so much for filling us in on your background. Always good to have people from the north back down to the south. Sure, all this lovely humid weather is amazing. But so tell us just some general information on pediatric GI. What do you do? What do you treat? What does that look like for you?
Right. So in general, we treat kids with disorders of the GI tract. So that actually covers a lot, right? So it involves your esophagus, which is your swallowing tube, your stomach, your intestines, your liver, and your pancreas. So in reality, we see kids who come to us with a variety of different complaints, ranging from abdominal pain, diarrhea, to constipation, to vomiting. We see kids who have difficulty putting on weight, or kids who have put on a little too much weight, perhaps. And then we see kids with chronic conditions of the GI tract, things like Crohn's disease and ulcerative colitis. So it's a really varied practice. And we see lots of different pathologies and different types of patients.
Okay, so do y'all treat, what ages typically are you looking at? Are you looking at like newborns that might have acid reflux all the way to teenagers? What does that look like?
Absolutely. So we see them from birth. So your spitty babies, your newborns, all the way up until 18. Sometimes we'll keep them until they're like 21, 22 or so, if we've been seeing them for a while. So that's usually the range of ages that we see, but we catch them when they're itty bitty babies and follow them until really they're adults.
Yeah. So as it relates to, and I'm fascinated just from the baby standpoint. I had one baby that was on Prevacid for, it was the exorcist style vomiting, and like everyone's like, baby, spit up. So how do you know when is the time? And I think we're going to get to this a little bit later, but like when kids are babies, when you have babies, you're almost hyper concerned about what's normal, what's not. So how would you know for a baby that it's time to check in with a GI specialist?
Yeah, so we see so many babies with issues with spitting up. And for the majority of them, I tell parents that reflux is more of a laundry problem than it is a health problem, right? Obviously, it's very concerning when you're a mom and your child is spitting up at 2, 3 a.m., you're not getting any sleep. The sort of red flag symptoms that we watch for, that sort of is my trigger for saying we need to do more of a workup, or I think we need, a specialist is important, is when now we're having issues gaining weight, if the child is now refusing to drink milk because the irritation is so bad to their swallowing tube. So if you otherwise have a healthy, happy baby who kind of just vomits on the side, then it's more sort of a laundry problem. They'll grow out of it. It's part of the newborn experience. But when you start talking about weight loss and bottle refusal and feeding refusal, that's when it's sort of time to see your GI specialist.
That's such a great point. A laundry problem. Gosh, I mean, I remember those days. But yeah, the experience of it all. But I do also have, I do recall the not gaining weight and then just the feeding aversion. And so definitely a red flag. So great point there. And so to kind of go into the next kind of big section of what you all cover, IBS and children. I know, some of, especially females, it seems, we may have IBS symptoms or things that we haven't necessarily identified, but it could be part of IBS. Can you explain what IBS is in the first place? And then as it relates to children, how do you know that they're presenting with such a thing?
Absolutely. So IBS, for those who are not familiar, stands for irritable bowel syndrome. So it sort of falls under a broader category of diseases that we call functional abdominal pain. And it's functional because there's no source of inflammation or infection or blockage that's causing these symptoms. Now, it doesn't mean that the pain isn't real. These kids are really feeling the pain. They're really uncomfortable. But it just means that it has more to do with what's called the gut-brain axis. So that's like a hot phrase now in the
Yeah.
field of IBS and functional abdominal pain. So the gut-brain axis is basically saying that we have this millions of nerves that function in our GI tract, and they help the GI tract do its normal functions like move things along and absorb nutrients. In some kids and some adults, it's thought that these nerves are hypersensitive. So things that shouldn't cause them pain or discomfort causes them abnormal amounts of pain. And there's different things that can trigger this. Sometimes kids can develop it after an infection, whether it's a viral infection or a bacterial infection. Sometimes it can be stress related. So these nerves are also connected to our brain. And we have all experienced this to some extent, right? When we feel nervous, we feel the butterflies. Nerves is something we feel in our mind, but butterflies is actual discomfort and pain we feel in our stomach. So IBS and functional abdominal pain is sort of along that same spectrum. And so kids will present with different symptoms. Most often I see them just present with abdominal pain, and it'll come on and off. Sometimes it's worse on school days. Sometimes parents can actually correlate what triggers their pain. If it's associated with changes in their bowel movements, so if they have pain and also diarrhea and pain and constipation, then it falls under IBS, irritable bowel syndrome.
Okay, so you talked about some triggers like stress. Are there certain foods that also trigger it?
There are some certain foods, and it's different for each child. And so one of the things I recommend that all kids try is trying to eliminate milk and lactose from your diet initially, because that can be a common trigger. And then for other kids, it's a matter of keeping a diary of, so that they can see and whether or not there's a pattern to certain foods that they eat and triggers that they have. There's a lot of research going on in sort of specific diets that can be used to treat IBS or functional abdominal pain. One of them is called a low FODMAP diet. Some of your listeners might have heard of that. It's essentially a diet that's low in complex sugars. And so one of the thoughts is that these sugars are a little bit harder for our GI tracts to digest. So they might go through and affect the bacteria, and the bacteria in your intestines can then digest it and produce gas and pain. So there's some research looking into that. And there's lots of different resources online about what foods are low in FODMAPs and what things you can try to eliminate.
Okay. How does gluten play into that? I mean, that's a big buzzword, and people going gluten-free, and there's gluten-free menus everywhere. Is gluten a contributor or a found contributor for IBS?
So for kids who have celiac disease, so actually diagnosed celiac disease where the gluten sensitivity is causing actual damage to their small intestine, it can present with very similar symptoms to IBS. The difference is that when we do our investigation and do our endoscopy and actually look at their tissue, they'll have evidence of tissue damage. There's this separate population of patients who are what we call gluten sensitive, don't exactly meet the criteria for celiac disease. And that's a little bit, more difficult sort of science-wise to explain, but certain people certainly do feel like if they eliminate gluten that they feel better. And so for those kids, I say that if you feel like it helps, I think it's worth pursuing, as long as we're able to maintain a well-balanced diet and it doesn't affect their growth and development. Because that's the big thing we care about in pediatrics, is we want to make sure they get the calories and all the nutrients that they need to continue growing and developing and maximizing all of that. And so,
Power outage. Oh gosh, and all of Houston just went, oh, you can't take any more power outages.
I didn't think what I said was that life-changing, but
it was that light bulb moment. Okay, so I think that's so important to mention too, that you guys are looking at the whole child. And I mean, obviously from, having children myself and doing research on certain things, I mean, there are certain amounts of calories and nutrients that your children need at certain ages to keep that brain function going. So what would you say to a mom, let's say her, toddler has just been complaining constantly of, stomach aches off and on, and they come in to see you? What are the steps typically that looks like of how you progress through the treatment?
Yeah. So, obviously one of the first things we do when a patient comes to our office is just take measurements, right? Because I want to know, how is the child growing? Where is height compared to her peers? Where is her weight compared to her peers? Has there been, and then taking a good history from mom. How long has this been going on for? Are we seeing any sort of concerning signs? Like, is she having blood in the poop as well? Or is she having profuse diarrhea all the time and now her appetite is not there? So some of those, getting a lot of that history can then help me sort of direct my workup from there.
Okay.
If I do feel like this truly is IBS or functional abdominal pain, I think, one of the most important things that we as providers can do firstly is give a diagnosis and explain the diagnosis, right? Explain to the parents, this is a real thing. Your child is suffering from a real thing, but it's not a dangerous thing, right? There's no long-term sequelae from this. And then really helping the parents by giving them a toolbox of things that they can try. So when we talk about treating sort of the gut-brain axis, you have to address the brain aspect and the gut aspect. So for the brain part, it's really trying to understand, are there stressors going on in this child's life? Is there something else that besides the eating that's causing this abdominal pain? And a lot of times we'll turn to our psychology colleagues because they can not only help manage that anxiety or stressors, but also give the kids sort of ways to manage their own stress. And then for the gut aspect, there's various different treatments that people are looking into. We talked about dietary changes, there's a lot of research looking into use of probiotics. Peppermint oil is a new hot thing on the market that's being looked at for IBS. And sometimes we use various medications, sometimes ones that are used as needed, and other times if it's really severe symptoms, then maybe daily medications. And the one thing I tell parents that it's important to acknowledge your child's pain. It's important to tell them you're hearing them, but it's also important to not to sort of perseverate on it, right? Because sometimes the more we talk about and the more we focus on it, sometimes it can worsen our perception of the pain as well. So encouraging your child as much as possible to continue doing the things that they love to do and were doing before, like going to school and doing all their sports activities as well. And sometimes that is a good distractor, and that's all you need to sort of get over the hump.
I think it's so fascinating, the psychology aspect of it. That's something I hadn't put together. I mean, it makes sense, but I hadn't put together. And ironically, my son ate breakfast this morning. He had his like normal breakfast, and then he normally turns on the TV and he gets his like 10 minutes to zone out before he has to get ready. And this morning he was like, Mom, my stomach. And he's just like laying there. And he doesn't get stomach aches very often, but I had a feeling it wasn't like dietary, you know what I mean? Like I had a feeling there's something that's going on like from a school issue. And as it turns out, there was something stressful at school, but it plays into how he felt. And so fascinating there. And so with IBS, that's one thing y'all treat. Celiac, what are some other common conditions that you would treat in your area?
Yeah, so we see a lot of, IBS, it's very common. I would actually say probably seeing it more now with the pandemic and quarantine and all of that stuff and all the stress of school and everything.
Mhm.
Lots of spitty babies who have maybe more severe sort of reflux symptoms. I have a particular clinical interest in inflammatory bowel disease, which includes like Crohn's disease and ulcerative colitis. So these kids have chronic inflammation of their GI tract and need help managing that. And then we see sort of your more medically complex kids as well who have feeding tubes that need help with gaining weight and all of that stuff. So it really runs the gamut. Oh, constipation. Who can forget constipation? We see lots of kids with constipation too. That's like our bread and butter.
No pun intended, because and I think that's something I would imagine. I'm not obviously not a medical expert, but that would be upped since pandemic, because I feel like we've all eaten differently since pandemic. We've had more indulgent meals, if you will, more things of queso. I mean, I'm just speaking for myself here, but things that might, stop a girl up, right? So
I think in general with the pandemic and quarantine, we've sort of let some of like the good lifestyle practices kind of go by the wayside. I think parents and kids forget the importance of a regular schedule in their lives, having 3 meals a day and having a set bedtime and waking up at a set time in the morning. And that can definitely affect how, circling back to the IBS thing, can definitely affect your mood. It can affect how you do mentally as well. So a lot of those,
yeah. And exercise, I have to think, plays a part. Like I know when my stomach hurts and I go and start moving, it kind of gets things moving too, right? Like, am I dreaming?
Nope.
I mean, not that I know anything about that. I would never, but yes.
Usually gets things.
So I know as we've kind of, and we're getting close to wrapping up. I know as I've talked to other medical professionals with UTMB Health over the past few months, the question is, when do you know to see a specialist and a doctor? And so tell me kind of when a parent has concerns, what's the next step they should take so that they can get in to see someone like you?
Sure. So I always advocate that we should first start with our pediatrician and our general practitioner. They're sort of our front line. they can help us identify some of those concerning signs or symptoms, and oftentimes can even help us get the workup started so that by the time you come see us, some of the things have been ruled out, some of the labs have already been done. So, our general pediatricians here at UTMB are wonderful, and they know sort of the concerning signs and symptoms to monitor for. And they're also really good at communicating with us if they ever have concerns or are unsure about something, that they can just give us a call or send us a message. Hey, do you think this child needs to be seen? And could you see them sooner than, your next appointment, etc. So the general pediatrician, I think, is always a great place to start.
And I love how seamless y'all's process at UTMB Health seems, because of the number of specialists that you have. There is a way for you to go and see all different types, including someone like yourself. And again, we always reiterate on every video, it starts with your GP and keeping those open lines of communication. So Dr. Goodwin, was there anything else that you wanted to cover before we close up today?
No, it's been a lot of fun speaking with you.
This has been great. And I love being able to educate our moms, and thanks to moms and doctors like yourself, who can speak to these things that, we don't often, pick up the phone and call our best friend to chat about. So thank you so much for joining us today, Dr. Goodwin. And again, Houston Moms, UTMB Health is our preferred provider for the Clear Lake, Galveston, Bay Area. And so we encourage you to go to their website. We'll put all their links as usual on this video, so you can go and check out. And they have a lot of great information in regards to everything, especially as it relates to COVID and all these other things that we've also talked about in these series of videos. So Dr. Goodwin, thank you so much. And I hope you have a great rest of your day.
Thank you, Megan.
Bye, y'all. Have a great day.